Types of psoriasis. There are 5 types of psoriasis. Learning more about your type of psoriasis will help you determine the best treatment for you. Plaque psoriasis. Plaque psoriasis is the most common form of the disease and appears as raised, red patches covered with a silvery white buildup of dead skin cells. These patches or plaques most often show up on the scalp, knees, elbows and lower back. They are often itchy and painful, and they can crack and bleed. Guttate psoriasis. Guttate psoriasis is a form of psoriasis that appears as small, dot-like lesions. Guttate psoriasis often starts in childhood or young adulthood, and can be triggered by a strep infection. This is the second most common type of psoriasis, after plaque psoriasis. About 10% of people who get psoriasis develop guttate psoriasis. Inverse psoriasis shows up as very red lesions in body folds, such as behind the knee, under the arm or in the groin. It may appear smooth and shiny. Many people have another type of psoriasis elsewhere on the body at the same time. Pustular psoriasis is characterized by white pustules, blisters of non-infectious pus, surrounded by red skin. The pus consists of white blood cells. It is not an infection, nor is it contagious. Pustular psoriasis can occur on any part of the body, but occurs most often on the hands or feet. Erythrodermic psoriasis is a particularly severe form of psoriasis that leads to widespread, fiery redness over most of the body. It can cause severe itching and pain, and make the skin come off in sheets. It is rare, occurring in 3% of people who have psoriasis during their lifetime. It generally appears on people who have unstable plaque psoriasis. Where does psoriasis show up? Psoriasis can show up anywhere, on the eyelids, ears, mouth and lips, skin folds, hands and feet, and nails. The skin at each of these sites is different and requires different treatments. Light therapy or topical treatments are often used when psoriasis is limited to a specific part of the body. However, doctors may prescribe oral or injectable drugs if the psoriasis is widespread or greatly affects your quality of life. Effective treatments are available, no matter where your psoriasis is located. Scalp psoriasis can be very mild, with slight fine scaling. It can also be very severe with thick, crusted plaques covering the entire scalp. Psoriasis can extend beyond the hairline onto the forehead, the back of the neck and around the ears. Facial psoriasis most often affects the eyebrows, the skin between the nose and upper lip, the upper forehead and the hairline. Psoriasis on and around the face should be treated carefully because the skin here is sensitive. Hands, feet and nails. Treat sudden flares of psoriasis on the hands and feet promptly and carefully. In some cases, cracking, blisters and swelling accompany flares. Nail changes occur in up to 50% of people with psoriasis and at least 80% of people with psoriatic arthritis. Genital psoriasis. The most common type of psoriasis in the genital region is inverse psoriasis, but other forms of psoriasis can appear on the genitals, especially in men. Genital psoriasis requires careful treatment and care. Skin folds. Inverse psoriasis can occur in skin folds such as the armpits and under the breasts. This form of psoriasis is frequently irritated by rubbing and sweating. If you want to find out how to get rid of psoriasis naturally, immediately, please click the blue link in the description or on the screen. Subscribe the channel to watch more videos.